Now we will revise bacterial infections. First is scarlet fever, where we see strawberry and or raspberry tongue. Strawberry because there is a white coating on the tongue initially, and the fungiform papilla appear as red spots on the tongue. And in the later stages, the tongue is completely red, therefore it is called raspberry tongue. Initially strawberry and in the later phase raspberry. Scarlet fever is caused by Streptococcus pyogenes, which is a beta hemolytic streptococci. The skin becomes like a sandpaper. We see sunburn with goose pimples. There are pastia lines, which are transverse lines on foldings, and the spread is centrifugal. We also saw centrifugal spread in the varicella zoster infection. That was the primary lesion causing chickenpox in children. There we also saw centrifugal spread. And in scarlet fever, it is also centrifugal spread. Now TB, it is caused by Mycobacterium tuberculosis bovis. There is ulceration on the tongue. It is granulomatous, and we see necrosis also, caseous necrosis. Histopathologically, we see epithelioid macrophages. Now miliary TB, it spreads through the blood in lungs. Lupus vulgaris is the tuberculosis of skin. The gold standard test to test TB are acid fast stain, Ziehl-Neelson's stain. Others are Montauk's test, then Lowenstein-Jensen's medium, PCR test, and ELISA. Now syphilis, which is Lew's disease, known as Lew's disease, caused by Treponema pallidum. It is a great imitator disease due to its variable forms, which can mimic other diseases also. The primary lesion is known as chancre, which is a painful nodular ulceration. The secondary lesion is mucor patches, which are painless, and it looks like a snail track ulcer. The primary chancre is painful and the secondary patches are painless. Now what is Lew's maligna? Lew's maligna is the explosive form of mucus patches, that is the secondary lesion. It is aggressive. The tertiary lesion is known as gamma, which is seen in palate. It initially is nodular and granulomatous, and later it ulcerates. Whereas in tuberculosis, we also saw there granulomatous, and then there was ulceration, but on the tongue it was present. And in the tertiary syphilis lesion, gamma, we see the ulceration on the palate, and in TB we saw it on the tongue. Both had granulomatous tissues and then ulceration. What is ragates? Ragates are skin folds or lines around the oral cavity. What is Higuminaki sign? When the anterior clavicle is enlarged, it is Higuminaki sign. When the legs are bent anteriorly, it is known as saber skin. What is Clutton's joint? It is the inflammation and enlargement of joints. Now actinomycosis, it has characteristic sulfur granules and molar tooth appearance of colonies on the medium. Now noma or chancrum oris, it is the sequel of the necrotizing ulcerative stomatitis, NUS. It is a gangrenous lesion where we see necrosis plus suppurated putrefaction. It is caused by Fusobacterium necrophorum. Now leprosy or Hansen's disease. Leprosy is also known as Hansen's disease, which is spreading via nasal secretions. It is caused by Mycobacterium leprae. It affects the peripheral nerves. It can lead to pseudodactyly. The test is lepromin test, which helps us in differentiating between tuberculous leprosy and lepromatous leprosy. The tuberculous leprosy is a resistant type. It is comparatively better prognosis than lepromatous leprosy. Next is diphtheria, which shows grey pseudomembranes. It is caused by Corynebacterium diphtheriae. We see fibropurulent discharge, which accumulates with the dead and necrosed epithelium and little blood elements. it is hard to remove. The great pseudomembrane is hard to remove. When submandibular lymph nodes are involved, it gives a bull-like appearance. Next is tetanus or lockjaw caused by Clostridium tetani. It can cause trismus in the oral cavity, and the characteristic is evil grin. It is known as evil grin or rhizus sardonius. Next is sarcoidosis, which is a multiple granulomatous lesion. We see Schumann bodies, and the diagnosis is done by Kevin-Slidsback test. Next bacterial lesion is Wegener's granulomatosis or strawberry gingivitis. Wegener's granulomatosis, also known as strawberry gingivitis.